Hello. Hi, everybody. Let me check again. Make sure I'm in the right place. It's Dr. Beth Cook. I hope everybody's having an amazing Friday. I am talking to you about birth control today. So if you jump on, sorry, I'm having some trouble here getting to my page. As you hop on, I want you to share this video. I want you to like this video. I want you to comment, tell me hi. Tell me how you're doing today. Okay, so I'm talking about birth control today. I've had several people reach out to me, and I've had patients recently too, and it's all been about birth control. So it's like, okay, I need to talk about this. Birth control can be controversial, and I'm sorry if it offends you what I say, but I guess I'm not sorry. But you know, there's a whole political side to birth control. Not going there today. I'm talking about your health and what birth control does to your body and your health. You know, you have every right to decide what you want to do with your body, but I definitely think that the other side of birth control is not talked about very often. Birth control, I feel like, is something very benign that we just, you know, oh yeah, I'm on birth control, no big deal, because that's kind of what we've been educated on, that it is no big deal, but it kind of is. It's a big deal. Birth control can cause a lot of issues. And so today I'm shedding light on that. Okay, your doctor, when you go see your doctor, she sheds light on why you should be on birth control, right? So I am giving you that other perspective. Doctors, and I only know this because doing my research for this Facebook Live, I listened to a podcast and I listened to an MD talk about her education and training in regards to birth control. So really the only thing they're trained on is the efficacy of the different types. And so they're trained to prescribe the types that are more effective. They're not really trained to talk about what birth control is really doing or the risk that they can pose to people. So that's what we're going to talk about today. So even me, I'm guilty. When I was on birth control, I was on it for very young, when I was a teenager, for like skin issues, acne, and then I was on and off birth control until I started a family, and when I was in my mid to late 20s. And so I was on birth control for a long time, and I think a lot of women are on birth control for a long time. They start in their teens, and then they stay on it until they decide that they want to start having a family, whenever that might be, in their 20s and their 30s, sometimes in your 40s. And so that has consequences. It definitely has consequences. So birth control is classified as an endocrine disruptor, which basically means that it is a synthetic form of hormone. It's not your hormone. It's not the hormone that your body makes. It's synthetic. And it is disrupting your hormone cycles that you have. It's basically interfering with that, the communication that your brain talks to your ovary, and it tells your ovary what to do so that you can produce hormones and so that you can ovulate. So birth control interferes with that process. So if we look at your cycle here, I know we did this last time, not the best way. I'm going to find a better way. So our brain, as our hormones are low, right? Our brain tells our ovary, hey, you need to start producing estrogen, or estrogens, excuse me, several of them, but this has estradiol, and estradiol will reach a peak, and that then sends another message to your brain saying, okay, we're ready. You have a surge of what's called LH, right here, luteinizing hormone, and then that tells our body to ovulate. And then those hormones will drop. Sorry, this is all backwards for me. It will drop, and then if there's sperm, the fertilization will occur, progesterone will increase and stay on, and if there's no fertilization process, then those hormones drop off, and that whole cycle repeats, right? So when you take birth control pill, what it's doing is it's stopping this connection that you have between your brain and your ovary, so that you cannot get pregnant. So I've had a lot of people reach out to me because I think they're confused about, they kind of have this, like, I don't really want to be on this, but I don't know what else to do, situation. And so that's my job, is to try to educate you about what you can do. So a lot of people are on birth control for prevention of pregnancy, but a lot of people are not. A lot of people are being prescribed birth control because they have certain conditions like PCOS or endometriosis or fibroids or painful periods. I mean, when I was young and I was on birth control, I was like, oh, this is awesome. I have lighter periods, they're shorter. I don't have cramps anymore. Like, this is awesome. But we have to understand why we're having painful periods in the first place. Why are we having such heavy bleeding? Why are my periods lasting so long? That's what we should be investigating, instead of taking a pill to then disrupt what's normal and natural for us, to suppress a symptom. So if you have something like fibroids or heavy bleeding or PCOS or endometriosis, and your doctor is telling you you have this condition and this is your only option, birth control is your only option, it's because that is what they are trained to do. That's what they know. They know that birth control flatlines your hormones and it can reduce some of those symptoms. But birth control also does the opposite. It's funny, if you look and see what some of the symptoms are of birth control, it's like, can cause acne or can cure acne, can cause mood disorders or can cure mood disorders, can cause weight gain or can cause you to lose weight. So, and that's because it's an endocrine disruptor. And so whatever's going on inside of you, birth control is going to alter that. So that's why it's different for everybody. But so when you go to your doctor and they say birth control is your only option, it's not because they don't know what they're talking about. It's because that's the only tool that they have, is birth control. They know that, like, if you have PCOS and you're on birth control, then that's going to stop the number of cysts that are forming because you're not ovulating. There's no follicle that's developing. So then you don't have cysts that are going to rupture, and you don't have pain, and you don't have all these other things. But if you really think about it, what is that pill doing? It's disrupting that connection between your brain and your ovary. And that signal is important because it's important not only so that we cycle and we have a period, but it's important for a lot of other functions in our body. Earlier this week, I talked about PMS and PMDD and talked about kind of the synergistic effect between serotonin and estrogen. And as our estrogens go up, so do our serotonin levels. And so that's why a lot of women that get on birth control can experience depression, anxiety, and they get on birth control, they don't connect the dots, they go to the doctor and say, I'm feeling really anxious, or I'm kind of depressed now and I don't know why, I've never felt this way before. And then they are given a prescription drug now for anxiety. That is something that's being caused by their hormone disruption, right? So that connection that we have between our brain and our ovary is really important, not just for your cycle, but for a lot of other things. So birth control can cause, yes, it's going to increase your risk of stroke and cancer. Okay, when I was 20 and I'm taking birth control, I'm not thinking about having a heart attack or a stroke. Like, I'm just not. And so I think I'm like a lot of other women. Like, we're not really thinking about that being a risk. If I was 45 and taking it, might be different. And so that to me was like, oh, that's the only thing that's going to happen to me, so no big deal. But there are so many things that birth control can cause. I already touched on one of them, anxiety, depression. That's a really big one. I see a lot of women that they're like, I just don't know what's going on with me. I really want to get off my birth control, but I don't have any other options, and I'm just really depressed, and My mood is all over the place. And it's because of their birth control. So birth control can cause a lot of depression and anxiety. And that too has to do with testosterone, what it does to your testosterone. So if you look at that brain connection, estrogen is an in-phase hormone, and we get estrogen from our testosterone that converts into estrogen. And so taking birth control can significantly reduce your level of testosterone, which gives us our sex drive. So birth control can completely take away your sex drive. I know I experienced that. As women, we think it's normal that we're tired, but as soon as you get off the birth control, you're like, oh, okay. So it's going to decrease your sex drive. Part of the reason why it causes anxiety and depression is because of that decrease in testosterone. It's going to increase your risk for certain cancers, female cancers, especially cervical cancer. There's a lot of studies that can connect. Now, if you go on PubMed and you look up research studies, I promise you're going to find a lot of ones that are promoting birth control, which is ridiculous, and talking about the health benefits of them. But I question who did those studies and who funded them, right? So there are a lot of studies that show correlations between increased risk of breast cancer, increased risk of cervical cancer, especially the longer you're on birth control. And it can also affect our fertility. So when you're on birth control when you're 20, your fertility is a lot different than it is when you're 35, right? So when you get off the pill at 34 or 35, your fertility has changed because your age has changed. And it might take you longer to get pregnant because you've been on birth control for so long and your hormones have been jacked with for so long. So birth control is something that we should not take lightly. Like I said, it can cause depression, anxiety. It can cause you to gain weight and cause nausea, vomiting. It can cause increased risk of stroke and cancer and heart disease. It causes clotting. It causes all kinds of stuff that we should take into consideration. And, don't blame your doctor or get mad at your doctor for prescribing you this thing, because like I said, that's what they're trained to do. That's what their training tells them. This is the tool that they have to use for whatever condition you may have, if that's what they're using it for, or if you have an issue. Hey Heather, how are you? Or if you want to prevent having a baby. So it's not their fault, but you need to do your research. You need to figure out what you're taking and what you're putting in your body, and if there's a better alternative. Cycle mapping is something that is pretty simple to do. I know that I am pregnant and not planned, and I am not on birth control, and so life happens, right? But babies are blessings, and I have a little miracle inside of me, so I'm grateful for that. But cycle mapping is pretty easy to do, and there are apps for it. You cannot get pregnant every single day of your cycle. If you track your cycle, you will learn that it's not possible. Oh, thank you. So if you cycle map and you figure out and learn about your cycle, then it can be pretty simple to prevent pregnancy without having to do something as destructive as birth control. So like I said, I'm here to present the other side of things, right? We've kind of been educated and preached to about how, birth control is benign. It's no big deal. You're just on the pill. It's fine. You may be a little moody, nauseous, you're okay. But there are a lot of long-term consequences that come from being on birth control, especially long-term. And most of us that get on it, unless we have some just like terrible reaction to it, when we're first put on it, then typically we will stay on it and for a long time until we start planning a family. And I don't care which birth control it is, okay? Even if it's the low estrogen or whatever, it's the same thing. It's an endocrine disruptor. That is how the drug is classified, and that's what it does. Doesn't matter what kind it is, if it's an IUD, if it's the implant, if it's the ring, if it's the pill, if it's the low estrogen, just the progesterone, whatever it is, okay? It's doing essentially the same thing. They work a little bit differently biochemically, but it's the same thing. They're achieving the same goal, and essentially they're causing the same long-term side effects. So if you have an issue like fibroids, heavy bleeding, PCOS, any other hormone-related issues, acne, weight gain, mood disorder, whatever, and somebody has prescribed you birth control to counteract that, and you don't want to be on birth control, and you know that long-term this is not a good solution, then you need to get tested. You need to figure out what your hormone levels look like in the first place. Hormones, like I talked last week, are secondary. So a lot of times they're off because something else in your body is off, whether it's your gut or your thyroid or your immune system or your nervous system. So a lot of things that can be going on that can disrupt your hormones. So if we test you, then we can figure out how to support your body so that you don't have fibroids, you don't have endometriosis, you don't have PCOS, you don't have mood, you don't have weight gain, you don't have all those things. So if we can test you and figure out where you're at, then we can use that as a tool to help you so that you don't have to be on it, so that you can have another option. Because I know that at least a lot of people that are reaching out to me, it's like they want to get off of it, but they're afraid if they get off of it, then they're going to go back to feeling how, painful periods and fibroids and cysts and all these things that they did not enjoy before. I don't know why you would enjoy it, but, and so I get it. It can be kind of scary to, get off of it and then risk and hope for the best. But if we can test you and we can figure out maybe some things that we need to change and correct, then we can get those hormone levels to rebalance so that you can have this normal cycle again, right? And that your brain and your ovaries are communicating properly, and that you don't have any long-term consequences from being on something like birth control. So it's a matter of, figuring out your cycle. Take the leap, stop taking it. If you have an IUD, go to your doctor and schedule to get it taken out, or an implant. Oh God, I had a patient the other day and I just thought, oh man, I don't know. I just think that would be awful to have that. But hey, you made the choice and that's okay. You can always take it out. So take the leap and get off of it and see how you feel, and contact a wellness weight doctor, somebody like myself, and we can test you and figure out what your body needs, what's going on inside your body. Why do you have fibroids in the first place? Why do you have PCOS? Why do you have super painful, long, heavy periods? Why do you have all this stuff going on? And then correct that. Give your body the support that it needs so that your hormones can rebalance and you can be normal again, right? That's what we all want, is just to be normal, just to not have to deal with all of this, right, surrounding our period. So I know it sounds great, like no period or shorter period or whatever from taking the pill or taking birth control. But long term, it won't be worth it. Trust me. Especially if you want to have a baby one day, especially if somebody's saying you need to get on antidepressants, things like that. So consider your options, that you can get tested and we can figure out what's going on inside your body. Trust me, if you've had your hormones tested by your doctor, you haven't had your hormones tested. Not thoroughly anyway, and not very extensively, so that anything can be done about what's going on. So that's all I got for you today. Hopefully that some of those that reached out to me that wanted to know more about birth control have a little bit more understanding about what's going on, what they're taking, what it's doing to them, and what other options that you have. I know, I'm sorry I don't have like a magic bullet solution for you, right? Take this supplement and your endometriosis will go away. It doesn't really work that way. But if you can figure out what's going on inside of you by doing some testing, which is a pretty simple process, then do it. Just do it. Stop waiting. Just do it. So anyway, if you have any questions, you can message me. I know sometimes this information is a little, private. You don't want to share. Hey, Dr. Jeremy, how's it going? Then you can message me or comment or send me an email. Hey, Brandon. Hello, everybody jumping on. I'm about to leave, so you have to go back and watch the replay. So anyway, yeah, if you have questions, feel free to contact me, and we can get you tested and get you feeling better so you don't have to take the pill anymore, okay? All right, y'all have an amazing Friday. I'll see you guys later.